Welcome to the Center for Bariatrics at Bailey Medical Center. Are you thinking about weight loss surgery? Well, the team here is so glad you've connected with us. As we embark into 2024, we know weight loss is often top of mind. It could be a New Year's resolution, a commitment to yourself, or even a new year of insurance. There are a lot of reasons why you might be thinking about weight loss and weight loss surgery, and we are here for you. So one of the first steps in the journey is often determining pricing and insurance. Joining us is David Stewart, Bariatric Program Director, to tell us more about what is often that first step. David, thanks so much for being here. How are you today?
Good.
Well, let's dive right into this. We know a lot of people are thinking about weight loss surgery, and one of the first things they think about is my surgery covered by insurance? So how does someone find out that information here?
And it is one of the most common questions that we get right away is, I think a lot of people understand the benefits of bariatric surgery or even our non-surgical program, but they just have a lot of questions about insurance because the financial aspect is important. So one of the things that they can do to verify their insurance prior to ever even coming into the program, honestly, is just go to our website. There is a tab at the bottom of your mobile phone that says Verify Insurance. At that point, you just put in your insurance information, and then we have dedicated staff here at the hospital to be able to verify your insurance, make sure all of the right codes and all the right things are said to the insurance company so that we can verify that before you ever even start the process.
It really sounds easy. It sounds like we here at the Center for Bariatrics at Bailey Medical Center take all of the guesswork away from you so that all you have to do is just put that information in and sit back, and then it sounds like we do the work for you.
Yeah, that's correct. And we do this for free. It's one of the few programs that do this verifying insurance for free. We do ask that patients verify also just as a double check, but it is something that we will go ahead and do, and then we'll communicate that information to you, typically within 7 days of you inputting that information into the website.
That's amazing. That was going to be my next question is, typically how long is the wait for someone to know exactly, okay, I put in my information and now I want to see exactly what my insurance covers. So really, it's that quick?
Yes, and so one of the things that we have to do is we will call that insurance company. Sometimes you really have to stay on hold a long time, but we're able to do that and actually have a conversation with the insurance company, giving them the procedure codes, giving them the diagnosis codes that we would have to have this procedure. And there's just questions that we are probably asking that your typical person who's contemplating bariatric surgery would not know to ask. So it's really important. Plus, this is a big decision, and it's a big financial decision, so we want to make sure that patients who are thinking about having bariatric surgery have all the information.
Absolutely, and because it is such a big decision, some people, their insurance will vary, and some people may find that maybe their insurance doesn't cover the surgery. However, you've told me that there are options when it does come to that. So what are people looking at?
Yes, we do have self-pay pricing. For the non-surgical program, it would be just the clinic visits, and then we also have dietitians and psychologists, and there's a whole multidisciplinary team of people that are helping these patients. So we have discounted self-pay pricing for all of those clinic appointments, and then also for the surgery itself. On top of that, we do have a company that does financing options. We actually have two companies that do financing options because it is an expensive process. But at the same time, you're talking about your health for the rest of your life.
Your health and getting your life back is just such a huge undertaking. And of course, we're ready to help people change their lives. When people are looking and they have gone through this insurance process and then they're scheduling surgery and they want to say, okay, David, when is my payment due? What's the answer to that question?
So the payment is due at the time of service. So if you're coming in for the clinic for your initial consult, they're going to ask for the payment for that initial consult. For the surgery itself, it is going to be the day of surgery, that payment's going to be due. So at the day of service, whatever that means with the surgery, with the dietitian, with anybody on the team, it would be the day of service.
Fantastic. That's really good information to know so that you can plan, as you are scheduling out your surgery as well. Sometimes, though, people are interested in weight loss and maybe not weight loss surgery. I really want to point out that we have two different programs here. Can you talk to me about the different programs, and then can you tell me if the metabolic management program is covered by insurance as well?
So what we actually do here is the Center for Bariatrics at Bailey Medical Center is to help those patients with the disease of obesity. And morbid obesity, these are diagnoses. This is not a personality trait. This isn't somebody's about their physical appearance. This is a disease process. So we have different treatment options based on each individual patient. One of those is bariatric surgery. One of those may be medication, or this may be behavioral changes within our multidisciplinary team. So there are medications that are available now. Some of the more popular medications right now are GLP-1s. It really does depend on each individual insurance. But what we are actually verifying is for bariatric surgery. We are not verifying insurance for your actual medication. So what does typically happen is, and it really does vary based on the insurance, you may have coverage for bariatric surgery, but you may not have coverage for medications. You may have coverage for medications, but not have coverage for bariatric surgery. So it really does just depend on your insurance.
Well, and that is why when you are looking especially at the surgery options, we really make it just so easy to kind of figure out exactly where you are. So I really want to point out again that what is so different is that you can find out this information, and again, it's free of charge.
Correct. If I was going through the program or had a family member going through the program, I would want to know what those financial obligations are before I started this journey. Because for bariatric surgery, it is a 4 to 6 month process. So you really are going through all of this testing. You're really making sure that you're prepared and it's as safe as it can possibly be. So we want to make sure at the end of this road, you don't have any surprises.
Well, we completely appreciate that. And again, we are here to guide you through every single process. And we know that because this is such a big undertaking, all you have to do is go to our website, which is bariatrics.com. We can help you with these frequently asked questions. All of these are online as well. You can find out information how to schedule an appointment, to fill out paperwork. You can watch videos. We so appreciate your time, and we are here for you at the Center for Bariatrics at Bailey Medical Center. Thanks for joining us.